So are you currently pregnant and heard the term toxoplasmosis? Yeah, it's a really rare one. But in this video, we're going to talk about what it is, how you get it, and my story on how I briefly had it during my fourth pregnancy. Welcome back, ladies. My name is Tabitha. I'm here to help all you busy ladies juggling jobs, careers, kiddos with no real time to exercise. I'm going to give you exercise tips, tricks, routines, and even product reviews to help make fitness a part of your life. And today we're talking about pregnancy, health, I guess you could say, toxoplasmosis. So I'm going to tell you my crazy story about how I briefly had it. I didn't really have it, but all the testing I had to go through to make sure I didn't have it. So we're going to cover what toxoplasmosis is, if I'm even saying that correctly, how you get it, and all the craziness behind this story of mine. So if you are new here, don't forget to subscribe and hit the bell to get notified every time I post a new video. So let's rewind. I am far beyond my toxoplasmosis diagnosis for temporarily. And I am 38 weeks pregnant right now. Well, at my 20-week sonogram, I will link the video here if you haven't seen that vlog. But I go to my 20-week sonogram, and it was just supposed to be a regular sonogram checkup, make sure the baby's good, anatomy scan, check it all out. And nothing is ever good when the nurse says, "Oh, I'm going to be right back. I'm going to get the doctor to check this, and we're going to see, and then if we can let you go." Anytime the doctor comes in, something's wrong, right? So he looks at the scan, and he's like, "Oh, well, okay. So you have this thing going on. You have this echogenic bowel in the baby." Now, an echogenic bowel, which, unbeknownst to me, you learn something new every pregnancy. An echogenic bowel is when the intestines is about the same color as bone, and it's supposed to be light white-ish gray, really, it's supposed to be really light colored. So he sits me down and he's like, "Okay," or I'm laying on this sonogram bed, right? And he's like, "Okay, so echogenic bowel can mean multiple things. It could be that you had some sort of internal uterus placenta bleeding, but you said no to that because if the baby swallows it, you can get that. It could be cystic fibrosis or Down syndrome, which none of those meet because you had a DNA check, so you're good. It could be a parasitic infection, which is what we're going to test you for because that's more likely the cause, or it could be a bad placenta and your placenta is not giving your baby enough nutrients to grow." And I'm like, "Okay, all right, well, we'll check it out. So what kind of parasites and viruses do I have now? So you're telling me something's wrong with me, right?" No. I had to go and get blood work done for toxoplasmosis. Now, really quick, what toxoplasmosis is, it's a parasite that is carried normally by cats. Cats are number one carriers for this parasite. And all the stuff I'm talking about, I will link articles down below if you want to dig a little deeper into it. But it's going to be informational, but kind of this wild story, like this wild adventure that I had. Like Murphy's Law was after my household from my 20-week, oh my gosh, for 4 months. Let's just put it that way. So from my 20-week sonogram, Murphy was after us until just recently. Murphy just kind of let up. He was like, "You guys are good. 4 months is kind of a long time." So I go to the labs and I get blood work done, and I have to wait now. And he said, "Oh, this blood work is not always 100%, so we'll see what the lab says." I'm waiting. I'm like researching toxoplasmosis, but I'm like thinking positive. I'm like, I don't know how I would have gotten toxoplasmosis, because he asked you, "Do you own cats?" "No, I don't own cats." "Do you garden a lot?" "I do garden, but I have a small yard, so I'm using like potted soil from Home Depot." "Okay, well, you probably don't have it," he says, "but we're going to test you anyways." So I wait a week later, and guess what? "Oh, your results in the lab came back positive for toxo, so we're going to have to bring you in for either an amniocentesis," which new thing that I learned about, either an amniocentesis or I'm going to bring you in for another blood draw because the tests have to go to the lab at, I think it's Berkeley, but it's in Palo Alto, California. This is the only lab in the US that completely tests for toxoplasmosis. Like, okay. And he's like, well, if you do the amniocentesis, you can get the results. It's going to take just as long to get the results, but you'll know if baby was affected or not. But if you do the blood test, then you're going to have to do the amnio afterwards if you're positive to see if baby got infected. I'm like, whew, whirlwind, okay? Like, that is a lot. What? If baby gets infected? What? So, I spent the weekend, that was a Friday, I spent the entire weekend researching toxoplasmosis. Come to find out that toxoplasmosis tested in a regular lab is 60% false positive rate. So I only had a 40% chance that I was actually infected with toxo. Okay, kind of low in the scheme of things. So 40% potential positive rate, or okay, I can take that. And then what I discovered is that if you become infected with toxoplasmosis, it doesn't always get to the baby. So in the first trimester, you are 15% chance that the baby will get it. In the second trimester, it's about 20 to 25% chance the baby will get it. And in the third trimester, it's about an 85 chance the baby will get it. Now, the problem with toxo that I discovered is that if baby gets it in the first trimester, lots of problems can happen. So the baby would come out normal, but you could potentially have eye problems, hearing problems, like brain problems, neurological disorders later in life. That's what they found. So it's not immediate. It's like a later in life, like the parasite gets in there and it kind of messes things up as it continues to develop. If you catch it and the baby gets it in the second trimester, you will still have some issues, but not as bad. And then in the third trimester, the baby will catch it, but it's even less of a risk. So it's not as bad as the first or second. The first trimester would be terrible, right? So I'm like, oh my gosh, that's scary. And as a mom, you know, you want what's best for your baby. So you're like a little nervous, but I'm trying to stay optimistic because I'm like, there's no way, how would I have caught this? So then I start researching the life cycle of this parasite. Now, this is the oddest thing. So they only tell you don't eat soft cheese and don't do kitty litter while you're pregnant. That's really the only guidelines, and they don't ever really tell you why not to do that. I know that they tell you don't eat soft cheeses or salamis and sandwich meat because of the listeria in it. That could cause problems as well and make the baby sick. But I've never heard the term toxoplasmosis. So I'm researching this crazy parasite. It's really common in France for women to get it, actually. But in America, it's not that common because the cleanliness and the guidelines. So people are a little bit more careful. So this parasite lives in a cat. And when it lives in the cat, it lives in there, I think, for only 2 weeks. Don't quote me on everything. I will put the articles down below because this was a while ago that I was researching it at 20 weeks. So I'm 38 weeks, so 18 weeks ago. In the life cycle, when the cat poops, the little eggs basically come out in their poop and they live in the kitty litter or wherever they poop. And so you're like, okay, well, it must be done. Once the cat gets toxoplasmosis for the first time, their body is resistant to it and they won't continue to spread it. So it's only like a 2-week life cycle for them. Also, I learned with humans, say you've had toxoplasmosis in the past, your body is now resistant or has an immune response to it. So if you get it again, it's not that big of a deal. However you pronounce the little egg part of it. They can live up to 18 months in a moist environment. So then I started backtracking. I'm like, okay, they can live for 18 months. Well, I don't own cats. I went and I traveled to the big island of Hawaii. That's where I'm from, to stay with family and friends. And I visited one of my girlfriends who has a little farm. She does goat milk and goat cheese and stuff like that. And she has a lot of cats. And while I was at her place, I was talking to her about her goats, because my dream is I lived on a family farm when I was little, and I want to have a farm again. I want a homestead, and I want to milk goats and cows. Okay, don't judge me too much. I know I'm a country bumpkin, okay? At heart, really. But living in a suburbia. So anyways, she milks her goats, and I was like asking her all the things about her goats. I was so interested. I milked her goats while I was there, and I wanted to try her raw goat milk. So being that I'm pregnant, I didn't want to drink the raw goat milk because I was concerned just in case. So I took a little taste of it, tasted it on my tongue, and I was like, wow, this is really good and sweet. And then I spit it out, rinsed my mouth, and went on my merry way. My kids were with me, and my sister was with me, and they all drank the goat milk. Like, my kids loved it. They wanted so much, but I was like, no, just a little, because your stomach is not yet used to this kind of product. So that would be something they would have to build up over time. So my crazy brain and the research that I found is that I could potentially have gotten toxoplasmosis from drinking raw goat milk. Oh my goodness. So now I'm panicking, right? A little bit. And now I'm looking at, what are the symptoms? Okay, the symptoms are, if you get it, you kind of get like little flu-like symptoms, a little bit sick because it's something infecting your body. And then I started thinking about the life cycle of this parasite. I'm like, would the cats really go out into the field where the goats eat grass, poop in a field of grass, and then the goats eventually eat it? That's kind of hard to believe, because, you know, if you've ever been around cats, they like dirt. They like little rocky dirt patches. They're not going to even dig. If you have a grassy yard, they don't even dig the grassy yard to poop, you know? So I was like, no, Tabitha, you're going crazy. Now you've really lost it. You think you got toxo, but the odds of that happening is so slim that that is probably not the case. So I kind of talked myself out of that. Then I was like, my kids didn't get sick from drinking goat milk. Let me ask my sister. Nope, not sick at all. And she drank the most of it, and she's not a crazy health person like me. She doesn't take vitamins or anything. So if something would have affected her, it would have kicked her little butt. Nothing. So I'm like, okay, I probably don't have this. Okay, so now I have to decide, when I go back to the office, am I going to get an amniocentesis to check the baby immediately, or am I going to get a blood test to just check me? Okay, so I look up amniocentesis, and I looked up other women who have had it done, and they said the procedure's not too bad, but later on you get a lot of cramping for a few days. You can't lift things, and it's really uncomfortable. Like, okay, that sucks, because I got to lift. My boys are pretty rough. I like to exercise. I got to lift my 2.5-year-old a lot. So that wouldn't be fun. Now, what are the risks? 1% chance that you're going to have a miscarriage. I don't like that. So I still was torn, but the doc told me, don't worry, after we do your test, we'll treat you for it just in case if you have it. That way you can clear your system and the baby should be okay. I was like, okay. So I go into the office on Monday and I'm still trying to decide. And the doctor tells me, well, the biggest reason to do the amnio is because, say the baby's infected or you're infected, you're going to have to do the amnio later. And if the baby's infected, you want the results as soon as possible to terminate the pregnancy. And I looked at him and I was like, well, no, that's not going to happen. So the doc was ready to give me an amnio, but we are a military family. We go to a military hospital for care. So if you don't know, military hospitals are notorious. There's a few of them, but they're notorious for being training hospitals. So that was a training opportunity for a resident. And I was like, yeah, no. not doing it. So I was like, we'll just do the blood test. I was like, I'm not taking that risk. I'm not going to be the guinea pig and put my baby at risk. I'm not getting an abortion, so not happening. So we did the blood test. The blood test took 3 weeks to come in. And during this time, of course, I'm reading more about toxo. I'm reading about how to cure parasites from my system. So I'm eating all the things, pumpkin seeds and super greens and all this stuff to help flush my system from parasites, right? Like a crazy person. As I'm leaving the hospital, he's like, gave you a prescription so that you can pick it up so that you can treat yourself just in case you have toxo. And I'm like, okay. So I go to the pharmacy, I pick it up, and he's prescribed me Bactrim. I guess Bactrim is a really, really potent UTI medication. It's got two types of antibiotics in it, and it's really potent. And I'm like, oh, antibiotics? Like, I don't want this stuff because that's going to wipe my entire immune system and my microbiome. Like, I really don't want to take this. Open up the package insert. Do not take during pregnancy unless the benefits outweigh the injury or whatever it said. I was like, okay, so now I have to research Bactrim and see what kind of effects this has on the baby. And it has, you can cause birth defects. And I'm like, oh, great. Okay, you know what? So I just said a prayer to God. I started to think logically, and I was like, you know what? The chances of me having this is really, really slim. So I did not take the Bactrim. I just ate super clean, parasite kind of cleansing, and I prayed, and I was like, I am not going to end up with toxo. This has been so stressful, but it's going to work out. It's going to pan out in the end. So again, 3 weeks for that lab results to come in. He said 2, and I called, no response. A whole nother week later, and he was like, your results came back and they're negative. Like, hallelujah. Thank you, God. I knew it. And so this was a whole crazy episode. After that, now I'm about 24 weeks pregnant when that all comes in. I have to go back for another anatomy scan at the 32-week mark just to see if I still have echogenic bowel in the baby or if I have any growth. So they're checking to see if the baby was growing at the correct rate. So at 20 weeks, they can't tell normally. That they told me that most babies are around the same size at 20 weeks, but it's when you get to later in the pregnancy that you can see if there is a difference in the growth of the baby. So I go to my 32-week sonogram, nothing, like echogenic bowel gone. Everything is good. And I'm like, so it's gone. So what does that mean? And the lady's like, it's called idiopathy, something like that, she said. Okay, don't quote me on that word either. I think it was idiopathy, which just means that they don't know why you had it and it just goes away eventually. And I'm like, okay, great. I just had a month of stress because on top of all the other crazy things that happened that month, but because I potentially had toxoplasmosis and I was worried for my health and the baby's health and how all this was going to pan out. So she does the anatomy scan and baby is just fine. Baby is actually growth size wise 3 days ahead of schedule. And I'm like, thank you, God. Thank you so much. So the point of this whole video is it's okay that I went through this craziness. I didn't know what toxoplasmosis is. And there are a few videos on toxoplasmosis online that are really, or on YouTube that are really old. And none of them were like from a pregnant lady's perspective or anything like that. So, moral to this story, I guess, because there is a moral in every story, is stay positive. You never know. Medicine is a practice. Like doctors work in a practice. Nothing is ever perfect. They don't have the answers for everything. So sometimes trusting your gut and thinking positive and doing extra research will pan out in the end. It was very stressful for me, but I was confident once I finally got over that like emotional, like, oh my goodness, this is crazy, the emotion of it all. And I had really looked at the numbers and convinced myself that I am probably okay. Once I got over that, I realized that I probably didn't have toxo. And it was protocol. We were going through protocol, really. And so I had to trust my gut and trust what I could do for myself here and now. So if you're going through something crazy, do a little extra research, look at some articles that might help you out. But don't eat soft cheese. Don't dig in kitty litter because you can get toxoplasmosis and it's not good for the baby, okay? Who would have known that's what it was? But I hope that story helped you through your either toxoplasmosis or some crazy pregnancy experience that can help you to be just positive, because things happen, and I think trusting in God is just the best route we can take, and just doing a little bit of digging. But as always, stay positive, work hard, and God bless. Mahalo for joining me. Aloha. Crazy pregnancy stories. This pregnancy, let me tell you, has had so many weird things that I never experienced with the boys. But I had to have a weird one, It just had to work out that way. So, see you soon in postpartum phase.